How do NSAIDs affect the diverticulitis gut microbiome? Imagine your gut as a bustling city filled with trillions of tiny residents working together to keep you healthy. These residents are bacteria and other microorganisms that form what we call the gut microbiome. They help digest food, support your immune system, and keep your gut lining strong. Now, when you take medications like NSAIDs or non-steroidal anti-inflammatory drugs, it can shake up this busy city in ways that might not be good if you have diverticulitis or are at risk for it. NSAIDs are often used to relieving pain and reduce inflammation, but they can also interfere with the balance of bacteria in your gut. They tend to decrease the number of helpful bacteria that protect your digestive system. At the same time, harmful bacteria can sometimes overgrow when the good ones are diminished. This imbalance can lead to increased inflammation in the gut, which is a concern for people with diverticulitis because their colon walls are already weakened. When the microbiome is disrupted, it can make the gut more prone to infection and worsen symptoms like pain or swelling. In addition to affecting bacteria, NSAIDs directly impact the lining of your intestines. They reduce the production of prostaglandins, which are substances that help keep the gut lining intact and healthy. When prostaglandin levels drop, the protective barrier of the intestines becomes thinner and more fragile. This makes it easier for bacteria and toxins to slip through the lining and cause irritation or infection. For someone with diverticulitis, where small pouches or diverticula in the colon are already vulnerable, this weakening can lead to flare-ups or complications. NSAIDs can also change how your gut processes certain drugs and substances. Some of the metabolites or breakdown products of NSAIDs are processed by gut bacteria. If the microbiome is out of balance, it can alter how these drugs are broken down, sometimes making them more toxic or damaging to the gut tissue. This can lead to issues like ulcers or bleeding, which are serious risks for those with diverticulitis. Overall, NSAIDs can negatively influence your gut microbiome by disturbing its natural balance, weakening the intestinal barrier, and increasing inflammation and infection risks. For people with diverticulitis, these effects might make their condition worse or lead to more frequent flare-ups. That's why it's so important to talk with your healthcare provider about pain management options. They can help you weigh the benefits and risks of NSAID use and suggest safer alternatives if needed. Remember, every person's situation is different, and personalized medical advice is always the best way to keep your gut healthy and avoid complications.